Overactive bladder affects millions of men and women in all walks of life, and it's more common in the elderly population because your bladder is supposed to relax at a very low pressure and hold a large volume of urine. But as you get older, it gets a little bit stiffer and doesn't hold the urine at a low pressure anymore. So you get a feeling of urgency, like you have to urinate all the time, and you're urinating at a much smaller volume. Now, some people can't even control that. They get the urge to urinate and they just lose control completely. That's called overactive bladder, or some people have an actual neurologic problem like a prior stroke that's causing that. Now, 80% of patients will get better with medication, so they say, but there's varying degrees of getting better and significant side effects from the medication, like dry mouth, constipation, confusion. So a new treatment that's come out that actually works superbly is just putting some injections of Botox into the bladder wall. Most of us are familiar with Botox being used for cosmetic purposes to treat certain types of wrinkles in the face, or even for migraines and things like that. But a new use is for overactive bladder, and it's really used in the same way. Just like it relaxes the muscles in, say, your forehead or in your face, and the wrinkles go away, it relaxes the muscle in your bladder and allows you to hold a lot more urine at a lower pressure, so you're not having to run to the bathroom all the time and you're not losing control from the severe urgency and bladder spasms that you get. Overactive bladder is really a significant problem in society. It doesn't sound bad, but you're using diapers, pads, and the cost of that adds up. It significantly interferes with your quality of life, not only just using the diapers and the pads and the cost, but smelling like urine, feeling embarrassed, or God forbid you leak around the diaper. It affects millions of people. It severely affects their quality of life in a negative way. And what most people don't think about in the elderly, most of the accidents that occur in the bathroom. People running to the bathroom to try not to leak urine on themselves will typically many times fall down and break a hip, which is a life-threatening problem, or fall down and have a head injury. So Botox becomes a very effective alternative to medication, minimal side effects, it's easy to do. The procedure itself is safe, it's quick. We can be done in the office with minimal discomfort. It's done under a light anesthetic, like a twilight sleep. And patients respond very favorably to the treatment. It improves their quality of life significantly with usually very minimal side effects.